So first, I want to talk about just the fact it's almost been a year since the first case of Williamson County was discovered. As someone that's an infectious disease, just I want to get your take on the last year. How has it been for you, just in your field, just seeing how much has changed and how much you guys have done? Just your reaction to the last year since we're coming up on kind of the anniversary of it, really.
Well, this has been without a doubt an extraordinary year. We were always worried, we in infectious diseases and public health, that a pandemic of this magnitude could happen, and it did on our watch. And every day has been a change because when COVID hit, as I like to say, we opened up our textbooks to COVID and it was all blank pages because COVID was new to all of us. The research that's gone on every front has been extraordinary. Public health, learning how this virus can spread and which populations were more seriously affected. Clinically, at the bedside, how this virus made people sick and how we could anticipate that and do better and get patients better faster so that they could leave the hospital. New diagnostics, new therapeutics. Our laboratory investigators helped us enormously. And now we have vaccines, many vaccines that we can use that are approved. And then all of the implementation efforts and trying to communicate what's going on to the populace so that we can all collaborate together to diminish the impact of this virus. And it's ongoing. The changes continue. We have new viral variants. We're developing new vaccines, which may be kind of second generation vaccines, which we'll have to use in the future. It's been an avalanche of information, and it's also been a professional challenge. And it is exciting that we've all been able to work together in infectious diseases, public health, at the laboratory, etc., in order to do the best we can to mitigate the impact of this virus here in Nashville, in Tennessee, and indeed around the world.
And you mentioned opening that book to COVID and it being blank. So now that we have come this far, are you hopeful for where we are right now?
Well, of course, I'm always hopeful for where we are and where we're going, but I am a cautious optimist. I think we have to actually take the good information that we have learned, the science-based information, and then apply it. And we have to do so carefully and deliberately. You can't do it carelessly. We've learned that something as simple as a mask is powerfully effective in protecting ourselves and protecting the people around us. We need to keep reminding ourselves of that, as well as the fact that we now have 3 splendid vaccines that we need to implement as effectively as possible. I'm asked, what's the best vaccine? The best one is the one that's available to you today. Get it. They're all great.
All right. And then talking about the masks. So we know that some places are starting to loosening restrictions, including expiring mask mandates. What are your thoughts on that? And are we letting our guards down too soon, at the right time? Where are we with that?
So about mask mandates being released, that makes me sigh because we've made those mistakes before. We've been on this roller coaster. And unless we keep using the mask and social distancing for some time yet, the roller coaster of cases will go up again as sure as the sun rises in the east and sets in the west. We've done that before. While we're vaccinating, we still have to stay protected and protect others with the mask. This is no time to be carefree. This still is a time to be careful.
Mm-hmm. So where do you think we are in terms of getting to the point where you and other medical professionals will feel comfortable with releasing mask mandates and opening things continually even more so back up and getting rid of social distancing? When do you think that would be a time?
So I look forward to actually the near-term future. Late in the summer, autumn, I would hope that we could have a near normal Thanksgiving, but it depends on two things. The first is acceptance of the vaccine by all features of our population, minority populations, ethnic populations who have had a traditional reluctance to be vaccinated and to accept vaccines. We need to make everyone comfortable, and we need to reassure them that these vaccines are safe and effective. So if everybody does indeed accept the vaccines, then I think end of the summer, beginning of the fall, we'll be back to something near normal. And then we'll have to keep our eye on those variants because this virus is outfoxing us a little bit, or trying to. So hang in there. New information will keep coming out.
And that kind of piggybacked into my next question is, where do you see us in a year talking about how hopefully a little bit back to normal by a normal Thanksgiving, but with these variants, do you see boosters a lot in the future? Where do you think we'll be in a year?
Even today, I think looking ahead, we could anticipate that, yes, each fall we'll have to get our flu shot in one arm and our COVID shot in the other, because both of these viruses change, they like to mutate, and we'll have to keep up scientifically to provide good vaccines that provide good ongoing protection. The virus, this COVID virus, just like the flu virus, it's not going to disappear. It's here now. It's part of our ecosystem. We will have to learn to cope with it in the best way going forward. And I think we can do that if we base it on the science.
And you talked about getting any vaccine that you can get right now, and that's the mission here. J&J, their vaccine is going to be coming to Tennessee. When it comes to, because people talk about, you hear the efficacy numbers and you see all those different things, and I've heard professionals, you just said it, that just all of them are good options. Can you talk to me a little bit about why people should trust all three of these vaccines, even though you hear these different numbers?
All three of these vaccines, effectiveness, they're all in the same ballpark. Let's not argue whether Babe Ruth or Lou Gehrig had the better batting average. They're both fabulous ball players. These three vaccines are all fabulous vaccines. Remember, they were tested in different populations at different times. Johnson & Johnson had to deal more with the variants because they did their testing a little bit later. So you can't compare them exactly. They all prevent hospitalization, going to the intensive care unit. They all protect us from dying. They're great. The vaccine you should get is the vaccine that's available to you today. Roll up your sleeve and get it.
And President Biden talked about how there would be enough vaccines in May for all adults, wanting them. When you hear that, as someone that's been at the forefront of all of this, being an expert on all of the national media and everything, local media, when you hear that there's going to be that many vaccines, does that just make your heart soar? Like, I'm sure it makes you so excited hearing that.
Well, hearing the announcement from the president that we will have an abundant supply of vaccine by the end of May makes me very excited, but I need to remind everybody, vaccine never prevented disease. Vaccination prevents disease. We have to move the vaccine from the refrigerator into the arms, and the arms have to come forward. People have to come forward and accept the vaccine. We're trying to vaccinate 80+% of the adults in the United States in a short period of time. We've never done that before, but I'm sure that we in the United States, if we work on this together, we can be successful.
So it'd be 80% of all adults that we're trying to get to that number, right? Or is there like
we're trying to vaccinate 80+% of all adults in the United States. And as we get more data down the road toward the end of the summer, we'll start vaccinating adolescents and then older children and then younger children on down the age range. We'll be doing that at the same time once the information, the data come in, probably toward the end of the summer.
All right. Well, I think those are all really my main questions for you. As always, great chatting with you, and thank you for making time for us. We'll let you get back to the busy day, and hopefully you have a great rest of your week.
My pleasure. Anytime. Thank you.
Have a good
And
one.
you're going to use this tomorrow, is that right?
I believe we're using it Friday, I think. So
Friday. Gotcha.
keep an eye out for
Okay.
it, but it'll be in
All
the
right.
morning. So if you're up and at 'em early, we'll talk.
Thank
You'll be able
you.
to see it. Have a good one.
Great. Bye-bye.